Hello, I'm Kathy Wibberly, and I'm director of the Mid-Atlantic Telehealth Resource Center, one of 12 regional and 2 national telehealth resource centers that make up the National Consortium of Telehealth Resource Centers, or TRCs for short. TRCs provide comprehensive, unbiased information, technical assistance, and education related to telehealth. Our goal, and that of our federal funder, is to increase access to quality health care, particularly for rural and other medically underserved populations. The Telehealth Technology Assessment Center, the federally designated TRC focused on technology, has invited me to share a little about one modality of telehealth called remote patient monitoring, or RPM. Most of us are used to receiving episodic care. This generally happens when we go to a clinic or provider's office to get routine physicals. When we have health conditions such as hypertension or diabetes, these checkups are scheduled with greater frequency than when we are healthy. During these visits, the healthcare provider collects health data such as blood pressure or blood sugar or heart rate or weight to monitor the conditions. RPM allows this monitoring to take place using digital technologies from the patient's home or wherever the patient may be located without having to physically go to a healthcare facility. These digital devices collect and transmit health data from individuals to healthcare professionals. You may have heard the term connected care. Connected care essentially leverages technology to deliver patient care outside of the hospital or doctor's office. This is not only more convenient for the patient, but also provides greater peace of mind for both patients and providers. With RPM, a patient's health data is transmitted to a healthcare professional with a regular frequency, sometimes daily, sometimes several times a day. When a person's health status takes a turn for the worse, or at least goes out of the normal range for that particular patient, a healthcare professional will be alerted. This allows healthcare practitioners to be more proactive, reaching out to their patients to determine if lifestyle changes, education, medication adjustments, or other interventions are needed before the patient starts to feel ill enough to make an appointment, or even worse, have to pay a visit to the emergency department. With RPM, patients often are also able to visualize the trends in their own health data, which promotes greater patient engagement. Presently, most RPM programs target patients who have chronic conditions that are not well managed and that put those patients at risk for emergency room visits and/or hospital admissions. The majority of RPM programs are time-limited, lasting anywhere from 30 days to several months. Typically, the digital technologies used in RPM programs are FDA-approved medical devices. However, in the past few years, we have seen a proliferation of biosensing wearable devices, including smartwatches that can monitor blood pressure and contact lenses that can monitor blood glucose. Some of these devices are FDA-approved medical devices like those used in traditional RPM programs. These wearables open the door for not just regular monitoring, but true continuous monitoring. Well-designed RPM programs have shown themselves to be effective in decreasing costs, improving care and health outcomes, and reducing hospital readmissions. In addition to traditional RPM programs, many monitoring devices are also available in the retail or consumer market and considered consumer devices, such as the Fitbit activity tracker. Though not FDA-approved medical devices, these consumer wearables generate important health-related data, often called patient-generated health data. The ability to effectively use patient-generated health data presents an opportunity for healthcare professionals to gain deeper insights about their patients, which ultimately could also lead to better outcomes and lower costs. Currently, these data have not been integrated into clinical practices and workflows, as they don't generally interface with electronic medical records or generate reports that yield actionable clinical information. However, we anticipate that this is on the horizon. The National Telehealth Technology Assessment Resource Center, more affectionately known as TTAC, is a great resource for you if you are trying to understand the many existing and emerging technologies that can be used to enable connected care. Check out TTAC's web-based toolkits and Innovation Watch postings at telehealthtechnology.org or visit TTAC's technology showcases at regional TRC conferences and events. And if you want to start an RPM program, visit matrc.org, where you will find a remote patient monitoring toolkit to help you get started.